Alright, so for the next type of antenatal care, we are going to look at what is known as a focused antenatal care. Focused antenatal care. I've looked at the World Health Organization 4-visit model, which was introduced in 2002. So right now I'm trying to look at the focused antenatal care. Okay, so of course the focused one is more of like each time the woman is coming to the hospital, you have something you are trying to target. You understand? So it's a streamlined, evidence-based approach to pregnancy care. It's developed to improve that the mother and the baby are getting the best care. Do you understand? So especially in low resource settings, that's like in places where basically you don't have the best healthcare, services, So it was introduced by World Health Organization in the early 2000s, following multi-center trials that showed fewer targeted visits could just be as effective, if not more. Okay, so it was more of like they were more focused on let the woman just visit a few times. Now for that few times, we have what we're actually trying to target in this woman. Okay, so the visits were not much, but they were strategic, meaning for each visit you had what you were targeting, so it was meaningful. So they recommended 4 targeted visits during pregnancy. The first visit was before 16 weeks. Okay, week 2, the visit 2 was within 20 to 24. Visit 3 was between 28 to 32. Visit 4 was between 36 to 40. Okay, so the risk assessment was also individualized. Okay, so that means you looked at every person personally to see if there's any risk. Okay, then you assess the risks, okay, based on the individual. So they did a lot of interventions, all those tests during the visit, like monitoring blood pressure, do urine and blood tests, probably to dictate if there's any infections. Tetanus toxoid immunization was given to those women. Iron and folic acid supplementation, malaria prevention, then birth preparedness, okay, and complication readiness, right? So I'm saying was because most hospitals don't use this way again, because most of them just say the visits are too small, all right, for you to be able to access the woman very well. So the woman was also educated on her nutrition and hygiene, all the various dangers around pregnancy. They told them about breastfeeding and newborn care. They told them about family planning, okay, how to prevent pregnancies if they don't want to give birth, okay. Not really that they don't want to give birth, right? If they want to allow their bodies to rest after this childbirth, so they can space their children, So it was revolutionary because that was back then in the 2000s, okay, and everything was kind of like still new. So of course anything that came with little improvement usually had a lot of acceptance and all of that. So it reduced unnecessary visits, saved time and resources in the hospitals. But right now we have much more hospitals now, on the other side we have much more healthcare providers now, so it was easier to implement in rural and low income setting. Okay, not really in the cities where mothers were educated and more concerned about how their pregnancies will outcome. So it also stressed on quality over quantity. So instead of coming too much at the hospital, they just put you on a small visit, and for each visit you come, they have what they're actually targeting to see. Okay, so that's for focused antenatal care.